Okay.
I'm going to send one more pop-up to request keyboard and mouse control.
Okay. So she can use this as
Yep.
well as we.
And then go ahead and get logged into the Foxfire training one.
Okay. There's another computer that I'd like to get this set up on.
Okay, do you want the training one, or are you going to want the live information on it?
Well, actually, I'd like both.
Okay, sounds good.
It's a laptop, and I think Doc needs to practice on the laptop. It feels different when you do a laptop than when
Yeah,
you do a
it
desktop.
certainly does. Yeah,
And
that's no problem. What we'll do is after this, we'll have you join the GoToMeeting from that laptop, and that's a super easy, actually we won't even join the GoToMeeting. I'll just do a screen connect. So if you want to power that laptop on when we're done training today, I'll go ahead and I'll get those added for you. That's no problem at all.
all right. Did you want to sign in?
I'm good. I can't. Password. Captain.
Perfect. We'll go ahead and get logged into EyeMD EMR, and I'll kind of let you drive as we get started, and then when the new stuff starts, then I'll jump in and walk through it with you.
This inter-office met, we need to do anything with that?
Nope, this is just your messages, kind of like emails that come through. This is just a test database, so that pop-up goes away after a few seconds. Go ahead and go to EMR Patient Flow, and let's search for that Foxfire patient. I think we were using Daisy.
Right. Right there.
This one?
Big letters.
The capital letter ones?
Mm-hmm.
All right. So the first thing I'm going to show you how to do here is on that dry eye appointment that we have on the 1st, I'm going to show you how to make some changes to it. So if you want to go ahead and highlight it, it's going to open up the visit summary screen. Now I want to change the date of service to today. So I need to click the edit visit button at the bottom right. But that button is grayed out. Because the visit is not today's visit, we have to hit the edit button at the top to make any changes, and that triggers an audit trail just showing that we made changes to the appointment itself or to the chart. So now go ahead and hit the edit visit button, and we're going to change the date of service by clicking the today button on the bottom right hand side of that calendar, and then I want to change the visit type to comprehensive.
Okay, we've got a question about visit types.
Sure.
Doc does a lot of eye infections. What is that considered?
This is actually a customized list, so you get to choose what you want to add. So if you wanted to add like an office visit or an eye infection visit type, in our next week's session, session 5, I show you how to customize those so you can create whatever visit types you want.
Good.
Okay, so some of these will already be in there.
Yes, some of them will already be in there, and then you will go ahead and we'll kind of show you how you can delete the ones you don't want or add ones that are missing. Absolutely.
Use all those
Okay,
too.
good. Thank you. I think you've told us that before, and I kind of forgot.
No, that's okay.
Okay, so what do you want to change it to?
Comprehensive previous, please.
And
All right, yep. And then we're just going to hit the update visit button. And now we have a visit that's updated for today. So our goal today is to go down to the doctor tab. And we're going to work, we did everything up through LensRx. So what I'm going to do, if it's okay that I drive here, we're going to talk about the next 3 tabs: assessment, plan, and coding. So I am going to, looks like some of these didn't catch because it's from an old date of service. So hang tight with me while I add a couple of things. And I'm just picking random things so we can, corneal abrasion, foreign body, workup. What I'm doing is I'm giving the patient myopia, and I'm diagnosing them with a few things based on my findings. Okay, so once you've gone through a visit and you get to the assessment screen, think of this as your diagnosis screen. There are 4 quadrants, as you can see, and I'm just going to give you a brief overview of each area, each box on the screen, and then we're going to talk about them in detail. So starting at the bottom right-hand side, this is a comments section. Pretty self-explanatory. You click in here and you simply free type. You would most commonly use this section if you resolved a diagnosis. So you saw Daisy Foxfire today and you indicated that she no longer had a corneal foreign body or a corneal abrasion. If you wanted to make notes as to why you resolved it, you could free type them in here. I will tell you that this section of the system is not very commonly used under the comments section. At the bottom left-hand side, these are possible diagnoses suggested in this visit or study. So based on today's exam, here are the 4 possible diagnoses that you may have found. Myopia was found using the manifest refraction. The system recognized that this patient was myopic. Blepharitis was indicated on the slit lamp screen, along with foreign body and abrasion. Now down here at the bottom, these are just suggestions. It doesn't mean that the patient actually has this condition, but instead what it means is here is an easy selection pick list for you if the patient does in fact have myopia, for you to just quick click and describe it rather than having to do a search to re-diagnose them. So let me show you what I mean. When I click on myopia, the system pops up to say, here are the locations that you indicated myopia. So it already has my right eye and my left eye documented. I need to update severity, and then I have to push one of the 4 buttons for priority. This is entirely up to you. There is no wrong answer here. It's up to the doctor. It just has to be completed. Now, before I click that button, I'm going to tell you what's going to happen. These 3 tabs work together. When I activate myopia and tell it how severe it is and what the priority is, it's going to say, okay, how are you going to treat it? So it's having me diagnose and treat the patient all in one fell swoop. That way I'm not breaking it into multiple areas that I have to complete a section of the exam. I can just do it all very quickly with the use of fast plans. So I'm going to show you what I mean here. I clicked on myopia. I said it was severe, or excuse me, mild in both locations, and I'm going to click chronic because it's ongoing. As soon as I did that, the system popped up with a fast plan window. On the left are a list of possible treatments or plans for myopia. So you would click through these, which are also fully customizable that we talk about in our next session, and you would find the one that best fits the patient. So for example, if I came into your office and you took my manifest, you would find that I need glasses. I'm myopic. I'm a -3. So you would prescribe me with an RX. But if Cindy came into your office, she has, let's say, a very little change. Maybe she's a -0.25. So today, maybe we don't need to dispense a glasses RX. We just say, hey, we're going to go ahead and monitor this for the next appointment. You know, it's a little bit of a change, but it's not enough to warrant getting glasses. But Martha comes in and you have a conversation with her and she says, I want to do LASIK. So you decide that, okay, this is a good candidate to talk about a LASIK consultation. So those are 3 different treatment plans. Well, rather than for me getting Morgan new glasses prescription or writing out for Cindy, no changes at this time, you know, RX small enough to avoid glasses. Or Martha came in and wanted to talk about LASIK, sent her to wherever. They're just pre-built. So this is the one that, well, I can find a LASIK one here. Refer eval LASIK. Here's the one you would give Martha. It would say, after discussion, patient wants to proceed with LASIK, and it would give them schedule a surgery with whomever. Here's the one that you would give Cindy. We'll continue to watch for changes at next appointment, so we're not doing anything right now. And here's the one you would give me. Dispense new glasses RX. So there are 3 different ones, and rather than free typing all of them, they're pre-built in a fast plan.
Oh.
So we're going to dispense me today. We're going to add fast plan to visit. So I find the one that best fits my patient and add the fast plan. The system is going to pop up, and sometimes it has a pick lock in it, which I'll show you on the next one. It says, which eye are you treating? That way it can be flexible, whether it's right eye, left eye, or both. And then it's going to pop up to say, did you provide education? You will always, always, always click yes. Now, I don't care if you print education, if you hand them a pamphlet, if you send them to a website, or if you just verbally talk to them about it. But you have to hit yes there, and then just hit the red X to close out. And let me tell you why. The system and CMS require that the system identifies and provides patient education about the patient's condition. So when that pop-up comes up and says, did you provide this? You will always say yes, and then you meet that MIPS measure. So it's just a quality thing you have to do. Now, we're going to do that same process over and over and over until all of our diagnoses are done. So if all I was treating today was Daisy's myopia, I would be done. But if she also had an abrasion, a foreign body, blepharitis, ptosis, whatever else comes up, astigmatism, then I would continue to go through that same process to add them. So I'm going to keep doing it. Click on blepharitis. It was only in the right eye, and it's moderate. And maybe this one was low priority. Here's 2 different ways to treat blepharitis. It looks like the difference is mostly in the eye medications. So here is one medication. Here's the discussion that's already built in, instructions that the patient can go home with, and staff follow-up orders, which we'll talk about on the next tab. Or if I'm going to do doxycycline instead, maybe that's best fitting, so I'm going to add the fast plan for doxycycline. Here's an example of a pick lock. It's picking me up to say on this SIG, which eye? Well, it was the right eye. So all I have to do is click right eye and go to next. Some of these fast plans have 10 pick locks, some have 0, some have 1 or 2. As long as that pick lock comes up, it just tells you to pick the location, and that's all it's asking for. Same thing, did you print or provide education? Why, yes, I did, but I don't need to print it. So as you can see, they're building up here at the top. The top left-hand quadrant is the active diagnoses for this patient. So Daisy has myopia and blepharitis. She also has, let's say, a corneal abrasion. In the right eye, it's mild and it's acute, but the system is going to stop me to say, you must specify a care episode. This is an injury. A corneal abrasion is an injury, and care episode is required for injuries. So the system stops you when you're missing something that is required for coding. So I'm going to say it's the initial exam with this injury, and then I can move forward. Then here's the 3 ways I might treat a corneal abrasion. So I find the one that best fits, and I add fast plan. You're going to notice this one also has a pick lock. Think of that like a token. But if I do it this way, I don't have to have a right eye corneal abrasion, left eye corneal abrasion, and both eyes. I can just switch out this token to whichever eye is impacted. And then I hit next, and that one only had 1, and there's my education. Yes, and close. So does the process of activating a diagnosis make sense to you?
Yeah.
Great. Now, what happens if a patient has astigmatism or has macular degeneration or whatever the case is, and it isn't on here? Well, the first thing we want to do is go back and make sure that we documented it. So on Fundus, I didn't document macular degeneration. So I better come in here and I better document based on whatever area we're in, whatever the case is. So in this case, I'm just going to grab one. Now, if I documented it, but it wasn't tied to a code, so you're going to see this one was tied to a code, and there it is, But if I did document it, but the code didn't come forward, you would be able to choose the code from the other double drop-down. Here's a full list of diagnosis codes. So I could come in here and I could either search by typing it into the filter search, or this is just alphabetical. So I could come in and I could take a look at all these different options that I have in here, and I could just check one. So I'm going to select this. We'll just do a nevus. So I check mark it. What location? It's in the right eye, and it's mild. This poor person's right eye is a mess. And let's say it's low priority, and then I could close this. And now you're going to see that I have nevus down below and up above because I activated it. So now you know what it looks like when they pull forward from your exam and how to select it if it didn't pull forward. Any questions on those pieces?
I don't think so. No.
Awesome.
Do you have to have a diagnosis, is what I want to say, for everything that's down here on the left quadrant, lower quadrant?
Great question. So the only time you'll activate it if it's a diagnosis that you are treating today.
Okay.
Okay.
So if I went into the doctor and I saw you today, I have gestational diabetes, you recognize that it was entered into the system, you're not going to treat me for it. You're instead going to treat me for my myopia, maybe my dry eye. So you
Right.
leave gestational diabetes unchecked.
Okay.
Yep, so that's
But it would come up down here.
Yeah, so in this case it didn't, but like if this
Yeah.
corneal foreign body, I saw that, or I thought I saw something there, so I marked it, but I'm not going to treat it today, it's not something I'm going to do, then you don't have to check it. You're going to check the ones you're treating today. That's a great question.
Okay.
Now up here at the top, this is where I was talking about resolving. Now, next year, when Daisy Foxfire comes into the office, this screen's going to work a little bit differently. Next year, when Daisy comes into the office, she still has myopia, okay? So I'm not going to recheck it and give her myopia again. Once I have myopia, I have myopia. So the next time that the patient is seen and you get to the assessment screen, even though there's check boxes at the bottom, you're just going to highlight what's already active and add a fast plan for it. Because when someone comes into the office and they say, okay, Morgan, you have myopia, you need glasses, the next year you're not going to say, okay, Morgan, you have myopia, you need glasses. You're going to say, looks like we still have myopia, there's been a change, so we're going to go ahead and get you a new prescription. I already know I have myopia. You've already treated me before, so you're not going to brand new re-diagnose me again. Another reason for that is if I were to add myopia again, I would have been diagnosed with myopia twice, and that's not correct. So again, when a patient has active diagnosis up here at the top, you're just going to highlight and treat them by clicking Add Fast Plan, because down here you only use these checkboxes to get them up to the top.
Okay.
Now, if this corneal abrasion was resolved, it's a year later, I can click the Resolve button. This indicates that the patient had a corneal abrasion, but since they came in last, it's now resolved. They no longer have a corneal abrasion.
Okay.
If I accidentally clicked that and didn't mean to, I can unresolve. So there is a way to flip it back and forth. Same thing goes, inactive. If this is no longer an active diagnosis, I can inactivate it. Or if you have glaucoma suspect, you took an image, you found out, okay, we ruled it out, you can also rule it out. So I could, and I'm just going to grab one of them, ruled out. So it's just a way to kind of manage what goes up at the top. Okay.
Yeah.
Any questions on the assessment screen?
No.
All right.
No.
So the next tab is the Plan tab. So think of this as we were on the assessment screen and we did all those fast plans for all the diagnosis we had. Well, all of that filters into this tab. So although we did them individually by a diagnosis at first, everything we did now shows up on one screen. So we're just going to talk about this one from top to bottom. You can view medication history or active diagnoses. You can enter their target IOP. So down here I have my max IOP, and I could enter what my target is for next time. Then here are my medications. They're broken up by eye meds and systemic meds. Now these came over from my FAST plan, but everything on this tab, even if it was on a FAST plan, is customizable. I don't need my patient to have artificial tears, so I'm going to delete it. So even though it was on a pre-built FAST plan, I don't have to do what the FAST plan says because every patient is different. So I deleted that one, but I'm going to leave my doxycycline. Now, when you have a medication here, if I need to add a new one, I just click the double drop down, whether it's systemic or over here for eye meds. So if I wanted to add artificial tears back in there, I'm just going to put in, let's just do this. Systane actually happened to have this sitting at my desk, so I'll just take a look at what it is. Let's just do Systane Contacts Eye Drops, or we'll just do this eye gel.
Yeah.
I can go ahead and I can add, 1 drop both eyes every morning, and I'm going to dispense 1 bottle, and I don't need any refills, and I'm going to add that med. So even though this medication wasn't on a FAST plan, I can still go in and add them a la carte as well. Now, I need to send these over to the pharmacy. So to do that, I click the Send ERX button. Now here's what's kind of backwards about this. There's these little check boxes here, but X equals do not print or send. So if you're sending these to the pharmacy, an X means no. So we don't want to do that, as weird as it sounds. Anything in these boxes that is unXed will be sent to the pharmacy. So I'm going to hit Send ERX, and this is a test database, so I don't know if it will actually work for me because I don't have a live NPI in here. So here is New Crop. This is basically the highway between the EHR and SureScripts, which is the big pharmacy database. Our goal here is to find our medications and follow the pink buttons. And we're going to go through this when you guys get your actual database too, so that you see it live. So down at the bottom, here are the 2 meds that I want to send. And I'm going to hit select. And this is where, before I was using this, it wouldn't go through. I don't think it's going to. So you can kind of see pre-production, this is not a secure live environment. Sometimes this doesn't always work because it's not a live environment. So if they're doing work on their test environment, then there's nothing we can do, and it looks like that might be the case. So we'll push this off until you guys have a live database, because then I know that it'll work. So let's throw that guy on the back burner. The next section down below is your plan and discussion. So outlining. For myopia, we dispense the new glasses RX. For blepharitis, we treated it as recommended. For the corneal abrasion in the right eye, we treat with antibiotic and ointment and apply a pressure patch. I didn't have to write anything in there because my FAST plan did it already. So there's nothing more that I need to do. Discussed with patient is the full sentence version of a plan and discussion. This doesn't go anywhere and would only ever be used in the event that this would have to be used for legalities. So the part that you need to make sure is updated is the plan/discussion on the left-hand side of the screen. Then down here, probably the one that you're going to use the most is patient instructions. It's exactly what it sounds like. Instructions that go home with the patient. We advised them to get a new glasses RX. For their blepharitis, we had them do warm compress. And then for the corneal abrasion, leave pressure patch in place until rechecked in the office tomorrow. Now these patient instructions, if you click this patient instructions button down at the bottom, these will actually print out for you. So this is really nice for those patients who have a lot going on. They have a very comprehensive and complex exam, or for your older patients who want to take notes and write down their medications and what they're supposed to do. Now you can just have it printed out right there for them. They can stick it on their fridge at home and they know who their doctor is, what medication they need to be on, and what their instructions are. So again, the information in the patient instruction box, if I click the patient instructions button, then that will print out for me. Now the surgical procedures performed and other actions, this is going to be more for the minor procedures. Do you do punctal plugs or epilation or foreign body removals?
Yep.
Okay.
Yes.
So this is where you'll put that. Most commonly my doctors put them under other actions. So you could come in here. Now, would it be okay to put it under plan and discussion just to say foreign body removal, removed with Q-tip or whatever you had to do? That's fine. But some doctors want that, the surgical side of it, so to speak, in a different section. So you can use either of these boxes. And you can either, in other actions, you can free type it. Surgical procedures is a selection drop down that you'd have to do. So you would come into foreign body and you would say whatever you had to do. So that just kind of is a checklist. I'm going to tell you that the surgical procedures drop-down isn't very commonly used. Most commonly, this is other actions, kind of like it says here, instilled drops and applied pressure patch, or removed foreign body with Q-tip, whatever it is. Any questions on that part?
The box you just had up there was the surgical procedure performed.
Yep.
Right. Yeah. That's, you hit that box and then it opens up so you can type in, or you just...
No, that one's just a selection list, and you just select what you did. And that would be if you were going to bill them for it.
Yeah.
Yep. So that's that CPT code. So it'll say, you performed a foreign body removal, 65222 if you're going to bill that. If you're just noting what you did, you're going to use other actions.
Oh, okay. Okay, got
Oh,
it.
okay, that's a
That's
little
what I-
different too.
That's what I wanted to know. I wanted to know that.
Yep.
If you could bill it or not, yeah.
Yep. Now down here at the bottom, this is going to be used, you're not going to use any of this stuff on the right-hand side. I'll show you letters that's in a session after this. These are just how to print the prescriptions, whether it's the medications or the orders, or we talked about instructions. This other stuff you aren't going to use because the front desk staff at the clinic isn't going to be doing anything for you in here. But under the staff orders, this is for items like if you want to refer this patient to another provider, or if you want to keep track to say, I told Daisy I needed to see her again in a year or 3 months or whatever, if you want that kept track of on your medical record, which I very strongly advise to do, this is where you put it. Now the other half of this is the clinic staff would come in and they would update it to say it was scheduled or recalled. But that part won't be done, which is totally fine. But that's another reason why I'm going to strongly suggest you make sure you enter this in here. So if on this patient, let's say that Daisy comes back, is going to come back with that pressure patch tomorrow, and I want her to come back for a checkup in a week. Maybe that's what I do. So down here under staff orders, I'm going to click add. Here's a list of things they might come back for. So I'm going to call it a follow-up,
Right.
and I'm going to call it a corneal abrasion because that's what I was treating. And I'm going to put tomorrow. So I'm going to do 1 day.
Okay.
So when I hit the next button, here's an order that just says we're doing a follow-up recheck for corneal abrasion, but maybe in the notes in here I want to put follow-up with pressure patch and hit save. Now what that's going to do is basically just be on the medical record for you, and in the event of an audit that just says, when I saw Daisy today, I told her she needed to come back in 1 day for that
Right.
corneal abrasion follow-up because we did a pressure patch. So that's all that that's doing. Now you can do this for any type of follow-up that you would possibly have. So let's say that I'm referring, because we're going to go back to Martha. Martha wanted that LASIK. So I'm going to go back and say I'm going to refer Martha and then whoever you're going to have, there could be a list here, or you could just do refer to, which is what I recommend. So I'm going to refer Martha, and I'm going to do at their next available. And over here on the right, I'm going to pick a doctor I'm going to refer her to. I'm going to refer her to Dr. Abner, and that was for the myopia, so I can just check the box. And I'm going to put refer to Dr. Cartwell for LASIK eval, or whatever we're going to do that way.
Yep.
And hit save.
Okay.
Now it's on the medical record that, hey, I saw Martha today, she wants LASIK, so I told the front desk that they needed to get it set up with that doctor. Does that make sense on how we document those pieces?
Yep.
Awesome possum. Any other questions on the plan tab for right now? We're going to go through ERX and letters on a later session.
No, that's fine.
All right. Last but not least is the coding screen. So we diagnosed our patient, we treated our patient, now we got to do charges for our patients. When you get to the coding screen, the very first thing you're going to do is you're going to complete the bright red drop-down, the medical decision-making complexity. How complex was today's visit? There is no wrong answer here. The only thing you could do wrong here is not fill it out.
Okay.
So I'm going to do moderate complexity. And then based on the level of the exam that you did, the system is suggesting things you can bill. Now, in this case, it sees that I did a refraction. So here's my 92015. If I want to bill this, I just click the box. So before I do this, I'm going to just kind of talk through what I'm doing. The left is suggested codes. The right is the ones you chose to bill. So when I click on refraction, it's going to ask me, what diagnosis codes are you tying to the 92015? Well, I should tie my refractive code.
Right.
So that's why it's checkmarked. Now, this is helping you through the process of coding by making suggestions for you, but you don't have to follow these suggestions. Ultimately, it's your practice, it's your patient, and you bill what you choose to bill. So on here, I'm going to do a refraction with myopia as my diagnosis code, and I'm going to click Save. Once I click Save, it goes to the right-hand side of the screen, and then I can go to my exam charge. So I'm going to bill the 92 code. Do you normally bill 92 or 99?
92.
Okay, so here's my 92 code, 92012. Now let's say I actually wanted to bill a 92014. Well, there's a reason that I didn't get that high, so if I click Coding Analyzer, it'll tell me why. So it looks like I didn't do my mental, and there was something in the exam I missed. So if I come back here and I fix those, sometimes it can be brought forward. So it looks like maybe I forgot to enter my dilation and my EOMs and my pupils. So let's see if that changed anything. I don't know if it will. Yep, it did. So here I am now. I have a 92014. So even those little things, if you forget to check mark them, you can actually click Coding Resolver or Analyzer, and here it's going to give you the point system. Well, I had 0 points for mental because I forgot to do my psychiatric. I only had 9 points for my exam because I forgot my EOMs. So down here it will tell you if you're missing something.
Okay.
So I went and changed it. I found my 92014. I'm going to click it. Now on this one, there's 4 of them I could attach. But you need to make sure they're in the proper order. So right now they're in the order that they look here, but if I want to put abrasion, then nevus, then blepharitis, excuse me, I can deselect or uncheck them and then check them in the order that I want. So I checked abrasion, nevus, and blepharitis, and I hit save. Now let me show you how we can look at it. if I click on comprehensive and hit edit, you're going to see them reordered in the order that I chose.
Right.
Now, if you want to bill something that isn't on this list, you have the other double drop down and a whole list of different things you could bill for. So for example, let's say I'm going to just do a fundus photo. Let's say I did a fundus photo, and if you do them, they'll come forward. But in this case, I'm going to do OU. It'll show up here, and now I can check mark it. So if you're missing something you want to bill, you just hit that other double drop down, and it'll be put on the list. Does that part make sense, or do you have any questions I can answer for you on it?
No, that's
Like
fine.
that, if that wasn't on there, you don't have to go back and put it on to show that you, I don't know, that you did it?
Well, you would have already done this in the system. Like you're funded. We haven't gotten to that session yet. That's like 6 or 7.
Okay.
Yeah,
Oh,
but
okay.
you would have already done it. Or in this case, if you wanted to bill for like that foreign body removal, I don't even know if that's on here. Or here, let's see, surgery procedures, corneal, foreign
Has to be
body removal.
removed.
Here we go. With slit lamp. So if I wanted to bill that because it didn't come forward, I could do that because it was noted on there. I did say I did it, but that code hadn't come forward. So that would be maybe is that a better example?
Yeah.
Right.
Okay, perfect. Okay. Now here's the end part of this. There's 2 other things you have to do. Number 1, you have to sign the chart, and number 2, you have to send the charges. I don't care what order you do these in. There's no wrong way. There's 2 sign chart buttons here. You're going to use the bottom one. So the top one is like if you had a like a tech or a scribe doing it for you. The bottom is when you do it. So when you click this button right here, and this is probably going to, yeah, it doesn't have a date of birth. So I think this one came over from, you'll never have to do this part. This one just, this patient somehow got added into the system. Not through the EH or through the PM system. So there we go. So when you do that and you click the sign chart button, so your signature is automatically going to be stamped at the bottom. Now let's say you go, oh shoot, I forgot to bill for blah, blah, blah. If you double click on your name, it will clear the chart signature. So that way you can go in and make changes, because once the chart is signed, changes stop. You can't make any edits. You'd have to unsign the chart to make any changes. So I'm going to click sign chart again. This is saying I don't have a valid social because I put just 5s in there. So you're going to have, your patients are going to have valid information. And then here's the button to send charges to PM. In order for this to bill out, you have to click the send charges button. Now, if you hit the send charges button and these pop-ups come up, they're your quality. This is what we used to call PQRS. It's now called quality. You just have to read what it says and answer honestly. You should never hit cancel or the X. So current medications were documented. However, the dosage was not done. So it's saying, okay, you took history for this patient, but you didn't enter a SIG for medication. Were they not documented because the patient is in an urgent or emergent medical situation, or time is of the essence, to delay treatment would jeopardize the patient? No, I just forgot to do it. You just have to answer honestly. Then you hit OK and you're good to go. And this little checkbox means that charges were sent to the PM. That way, practice management, that's Foxfire PM. That's the one with the glasses. And that's where we do our checkout. with the patient.
Oh, okay.
Yep. Okay. So that's it. That's all we have to do for those tabs.
Oh,
I bet.
you gonna remember all that?
Yeah.
And that's why we have the session recorded too. So I wanted to look at a couple things here. ST11. We have, I know we got our EMR sessions down. We got PM. We are scheduled for the next session next Tuesday.
Okay.
So we have 4 weeks before we go live, because you guys are right now scheduled to go live on April 3rd. Okay? So
Yep.
here's what the next couple weeks are going to look like. Next week, Tuesday, we're going to go over customizations.
Okay.
On the 21st, then we're going to jump into imaging and kind of just there's like some odds and ends training that doesn't really fit with anything else. Then on the 28th, I'm going to teach you how to check out, how to do quick orders, check out, so that you can get your charges over to your biller. So that's what our schedule looks like coming up. Okay.
Okay. You want something over there, babe?
And actually,
No.
so if it works for you guys to bump these up, like if we can keep doing them earlier, that's perfectly fine with us. Just let us know. I usually will.
This depends on the schedule.
Yep, and that's okay. We'll keep them for the 6 o'clock time, but if you want to bump them up, just give us a call. And then usually the end of day we have pretty open. I actually have next week combined session 5 and 6, and then the following week we'll do the checkout. So we're still set and looking good for the go live of the 3rd. I did request your actual EMR license was requested today. So maybe by next week you'll actually have your live database, so that when we train on Tuesday we can make all those customizations in your actual database.
Oh, okay.
So that's my goal. If it's not next week, it'll be just a couple days after our training, for sure.
So you didn't do anything with that?
Yeah, I wanted to put the Foxfire on there.
Okay. Do you have that laptop fired up?
Yes.
Awesome. Do you want to go, I'm going to have you go to a website, which is our support site. So let me know when you get there, and I'll give you the website to go to.
Just give it to me now, and I'll write it down, then I'll go do it.
Okay. It's well, you don't even have to do www. It's support dot foxfiresg.com. So support.foxfire, S as in Sam, G as in George.com.
I can probably hear you. It's not that far away. Okay. Turn on.
And then when you get there, it's going to ask for a code. Let me know when you see that, and I'll give you the code that you need to enter.
Support.foxfire?
Yes, support.foxfiresg.com.
It says I can't reach that page, huh? Let's try again. Okay. Okay, I'm ready for the code.
S as in Sam, T as in Tom, 1, 1.
And then enter?
And then hit the join button or enter, yep. And what that'll do is that will let me see your, screen.
Joining session.
Okay, so it may ask you a couple things. It may ask you about, like if you want to run or make changes and you just want to hit yes, save, or run all the way through.
It's downloading.
No problem. While it's doing that, I'm just going to give you a quick heads up. I'm sending a form to you in your email that I want you to, you can either fill it out on the computer or you can print it out and write it in. It's a requirement for ID proofing for e-prescribing. So it's going to ask you to fill out the doctor's information, but then we have to have a credit card in there. It'll tell you all the reasons why. And then once I get that back, then I can finish the request for your active license.
Okay.
So whenever you get that, I just sent it over there. Just go ahead and get it back to me as soon as you can.
It's only about a fourth of the way done.
No problem at all. I'm actually multitasking to try to get that license request updated for us, just letting them know that we'll get that ID proofing in just as soon as it comes over. So
Okay.
that is no problem.
It's the biggest tournament.
Yeah. Illinois is one of them.
Is this like the bottom of the row? Is that along here? I thought it was.
Nebraska's not scheduled until tomorrow.
Well, Nebraska's in the Big East.
No, that's
Now,
right.
this is the Big Ten.
Yeah.
Nebraska plays tomorrow.
Probably like at 8 o'clock in the morning or something. I don't know. I didn't see that.
Okay. Now let's see that. Really the day tomorrow. Oh, it's almost over with. That's all the score there is?
Yeah. Wouldn't be much of those two.
So, let's get it on.
Why did you call it Jones? It's actually on one guy's stuff out of Jones. You must not have seen that. Oh no. What they do is John White. See, the one over there went out of Jones. Okay, it's done.
All right, 1 second. I'm going to drive the computer for you.
You change your mind.
Okay, it looks like your screen is still trying to load for me. Can you see me moving your mouse?
No. There.
There we go. Okay. Okay, you are all set. They are added, and you're all good to go.
Okay.
All right, I will talk to you guys next week, but as always, give me a call if you need anything in the meantime.
Okay, thanks a lot.
You guys have a good night. Bye now.